My name is Kramer. I'm a physician specialized in kidney diseases and high blood pressure. And I have been very interested in integrative medicine for many years. And my hope is that one day we'll be able to lift the barrier between conventional and alternative modalities of treatment to be able to offer patients anything that would be able to help them more. Interest in integrative medicine has been centered around Dr. Revici's work. Dr. Revici was my grandfather's brother, and he was the person I came to in the United States as soon as I finished medical school. I wish I understood him better then, and would have taken more time along with him to grow along in the field of integrative medicine and alternative treatments in cancer. Dr. Revici passed away 10 years ago. The atmosphere in the medical environment about 20 years ago, when he was still active despite his age, he died when he was 101 and a half, was not very conducive to alternative medicine. He had spent a lot of time defending his genuine and innovative position instead of using this time creating more. He's been well known in the complementary medicine for his non-toxic chemotherapy, for the ability to optimize the immune system and help patients improve their condition by having a stronger, more effective response to their disease, and by his results in viral and viral diseases as well as in addiction. To understand a little bit the concept of non-toxic chemotherapy, we have to think of toxic elements that he had used, such as selenium, sulfur, bismuth, incorporated in specially selected lipids, which offered not only a transport mechanism for these toxic elements straight into the abnormal cancerous cells, but also carried along an anti-cancer effect. By having the toxic elements surrounded by a lipidic formulation, they are not toxic to the individual who takes them, because the individual is not directly exposed to the toxic element. After these complex of a toxic element and lipid are penetrating the cellular membrane, and in particular the cancer cell membrane, inside the cell, mitochondria and other organelles will digest the lipidic shelling, exposing the toxic element inside the cancer cell. There is a particular attraction by the rapidly growing cells to these complex of lipids which include toxic elements, because in their growth these cancer cells require such lipids. Dr. Revici came up with breakthrough concepts in management of cancer patients. He took the role of the immune system to levels unaccepted before his time. He came up with vaccines made out of cancer tissue, purified proteins from cancer tissue, re-injected in the patient in an attempt to stimulate the immune system to create and direct antibodies against the cancer cells. My name is Kramer. I'm an internist specialized in nephrology, which is kidney diseases and hypertension. My office is in Paramus, New Jersey, and my interest in integrative medicine has been growing for the past 25 years. The reason is that my grandfather's brother was a person that I came to in the United States after I finished my medical school in Romania, was a pioneer in the field of complementary medicine. After I finished my residency program at Albert Einstein and Bronx Lebanon Hospital, I went to Mount Sinai Medical Center, where I completed a fellowship in nephrology. The interest in complementary medicine, in particular non-toxic treatments for cancer, was stimulated by the work of Dr. Emanuel Radici, my grandfather's brother, whose success in treating patients without toxicity was impressive. The interest in integrative medicine has been stimulated by the incredible success that I have witnessed in the patients of Dr. Radici, and lately in my own patients following his modalities and other non-toxic complementary modalities. I am determined to take this effort to the schools of medicine and to hospitals and research programs, and to attempt to incite their own interest in further developing non-toxic modalities to treat patients with cancer, autoimmune, viral diseases, as well as treatments in addiction. Having treatments without serious side effects has been a desire for more and more patients. Not all of them respond well to conventional therapies. Not all have enjoyed just the favorable effects of strong conventional therapies. Many have suffered from the intense toxicity from the current treatments given, and enjoy being effectively treated with non-toxic substances. Well, what I'm trying to say basically here is that we would like to share the experience, the fact that we have been helping patients for years, and their experience is often either treated with disbelief by their own physicians. Sometimes they are congratulated for their good results, and nobody moves on to the further step. I really want to be able to take the concept of complementary medicine to a higher level. And I think that there will be hospitals and research centers today who are which are ready to take the responsibility of looking seriously at such approaches. The controversy about conventional therapies exclusively versus alternative exclusively are not a subject that interests me too much today. We have had patients who received a combination of conventional therapies and our therapies, and are doing better than those who have received conventional alone, at least based on